Transgender Health and Main Care, brought to you by the Maine Transgender Network and the Mabel Wadsworth Center. In this video, we'll discuss Maine Care coverage of medical transition-related health services, as well as qualifying for Maine Care and appealing denials of coverage.
What is Maine Care? Maine Care is Maine's state-level Medicaid program. It provides state-supported health insurance for low-income Mainers, people with qualifying disabilities, and youth in the foster care system. Maine Care is a means-tested program, which means that access to its services are based on meeting certain criteria, such as income level or documented disability status.
In fall of 2019, Maine Care released their new policy covering gender-affirming care for transgender Mainers. This policy ensured that Maine Care more definitively covered hormone replacement therapy and now specifically covers gender-affirming surgeries. Qualification for coverage is based on the World Professional Association of Transgender Health, or WPATH, standards of care, and includes coverage for both adults and minors.
So what, specifically, does Maine Care cover for gender-affirming care? Maine Care now covers hormone therapies, such as estradiol, testosterone, or progesterone, as well as androgen suppressants like spironolactone. Maine Care covers most gender-affirming surgeries, such as commonly known top and bottom surgery options, as well as services like facial feminization surgery or removal of gonads.
Typical paperwork requirements to access top surgery, such as mastectomy or breast augmentation, includes a letter from a physical health provider, such as a primary care provider or hormone prescriber, and one letter from a mental health counselor. There is no specific requirement from Maine Care for a minimum number of appointments with either of these providers, but it is common among mental health providers to expect to meet with you several times. Letters of support for gender-affirming surgery must be addressed to the surgeon for insurance to accept them, not to whom it may concern. If not addressed correctly, Maine Care will likely reject the letter and require it to be fixed.
Paperwork required for bottom surgeries, such as hysterectomy, removal of the uterus, orchiectomy, removal of the testes, vaginoplasty, creation of a neovagina, phalloplasty, creation of a neopenis, or metoidioplasty, unsheathing of the clitoris, require additional documentation. This often includes one letter from a physical health provider, one letter from a regular mental health counselor, and an additional letter from a mental health provider who was offered a secondary evaluation. Documentation requirements vary by individual surgery options and surgical offices, and are not just based on the requirements set by Maine Care. It's important to be in touch with your surgeon's office to ensure you have met their specific documentation requirements. Additionally, not all surgeons who provide these procedures are registered with Maine Care, or accept Maine Care for payment. It is important to clarify this with the surgeon's office before scheduling any appointments.
Currently, there is only one provider in-state who consistently takes Maine Care that performs top surgery, mastectomy, and augmentation: Dr. Marble with Surgical Associates of York Hospital. We do not currently have any surgeons in-state who perform genital surgeries, such as vaginoplasty, phalloplasty, etc., so this will need to be sought out of state, which requires a little extra paperwork for Maine Care coverage approval. Surgeries such as hysterectomy and orchiectomy can be accessed in-state by any surgeon who performs these procedures that is covered by Maine Care.
Some common challenges we've seen transgender people experience with Maine Care include the following. Maine Care has preferred medications that they cover. This means that other methods of administration, like injection testosterone versus testosterone gel, for a medication may be a little hard to get covered. Secondly, the Maine Care policy is new, which means that we have run into some hiccups while Maine Care figures out how to navigate the new policy. This includes difficulty in getting them to cover some services, such as hair removal, that should be covered. This will continue to improve with time. One other issue with the new Maine Care policy as how it has unexpectedly interacted with older MaineCare policies. One example is mastectomy for people between the ages of 18 to 21, as a policy on the books for breast reduction requires people in that age category to get a second opinion. These issues are being addressed.
Please be aware, some surgeries require you to be on hormones for a period of time, such as breast augmentation, while others do not require that you are on hormones at all. These requirements vary by procedure and by how your body responds to hormones. If you've exhausted all in-state options for surgeons, you can get an out-of-state exception for MaineCare coverage for a procedure.
A few things to keep in mind. Qualifying for MaineCare. With the MaineCare expansion, many more people qualify for coverage now. You can qualify for MaineCare based on your income if you make 138% or less of the federal poverty level. For some people and situations, the income guidelines are more generous, for example, with pregnancy. The federal poverty line changes every year, and you can check what the current income guidelines are through MaineCare or Consumers for Affordable Healthcare.
If you get a denial of coverage, you will receive a letter that explains why the coverage was denied and what needs to be done to appeal it. Most of the time, insurance will include a time frame for submitting the appeal. You can get help with your appeal from your healthcare provider or an organization like Consumers for Affordable Healthcare. If you miss the appeal deadline, don't panic. This does not mean you will never get this care covered. This just means your provider will submit the paperwork again as a new case instead of updating an ongoing case.
Finally, if you need help navigating your insurance coverage or healthcare needs, there are a number of organizations in Maine willing to help you. These include the Maine Transgender Network, Mabel Wadsworth Center, Equality Maine, Maine Equal Justice, Consumers for Affordable Healthcare, and MaineCare Member Services. You can find links to these organizations in the description of this video.